Is that pretty sore in there?
It's not sore, it's just getting there. It's fine.
Alright.
But it's not short of being...
G'day, how's going? This patient here was suffering a moderate ankle sprain which he incurred whilst hiking overseas and was coming to me for some relief. I'm starting off with some active release technique, otherwise known as ART, and this technique is essentially a combination of stretching and massage rolled into one. I'm treating his anterior talofibular ligament, which is the ligament that is commonly injured when you roll an ankle, and I'm drawing his ankle from an upwards and outwards position to a downwards and inwards position and stripping the ligament in between to rid it of any muscle adhesions.
So what might be my expected recovery to go for, let's call it a 5K walk?
One to 2 weeks from this point.
Christ.
Yeah. I mean, you said just lifting stuff yesterday, you felt it fatigue.
Yeah, but it wasn't hurting.
You could do a 5K walk now. I mean.
Yeah, but I want to be able to do it the next day. You know what I mean? 5K is then 2 weeks with ice and a moon boot. That's not my question. You know what I mean?
Yeah.
You know what I mean? I'm not here to be an Olympian. How long before I can deadlift?
Oh, jeez.
Or squat?
What sort of deadlifting were you doing? What sort of weight?
80 to 100.
You can see I've now moved on to graston technique, an instrument-assisted soft tissue technique where we use specially contoured stainless steel instruments to strip away any scar tissue and increase blood flow to the injured area.
Are you saying that's just completely ridiculous question? Is that why you're silent?
Oh, sorry, I was focusing. Sorry. I think I would say closer to 2 weeks for that.
Okay.
Yeah. Why don't we aim for 5K walk by the end of this week and deadlifting by the one after? How long has it been since you did it? It's only been...
2 weeks.
Is this sore in here?
A little bit, but it's not too bad. If you think this is doing me some good, I'll tolerate it.
I do.
So just keep going.
Do you want to zoom in on the redness here a little bit, Lara? So you can see that faintly red area starting to appear on the lateral aspect of the ankle. And this is the intention behind using graston technique. We want to bring blood to the affected area because blood is what carries all the nutrients that will allow that tissue to repair. Sorry. You'll also notice there's a couple of different tools I use. That first one, I call it the ice pick. It's pretty intense. It's quite sharp, the tool.
All right.
And it's a very focused tool. So if I'm trying to get to a specific area, I'll use that tool. This one you see here now is a bit broader and has a curved aspect, so as I can embrace the lateral malleolus. That is that sort of the ankle bone, if you like. And I'm just trying to get all aspects of the ATFL, the ligament in question. And it can be pretty sensitive on the outside of the ankle. Regarding the redness as well, you don't always get as faint a reaction. Sometimes you get a lot more red reaction and purple starting to appear. You okay with this?
All good.
Yeah, you're doing well here. Moving on to some dry needling now, and apologies for the upside down view. I don't know what happened post-production. Anyway, people always ask me, Tom, how does dry needling work? Essentially, it does two things for us. It increases blood flow to the affected area, and it helps relax tight tissue. The sticking in of needles into the tissue causes blood to flow. It's just like when you cut yourself. And remember, blood carries all the nutrients that helps feed tissue and thus nourish it from an injured state. Also, real-time ultrasound studies have shown that the introduction of needles into tight tissue, we observe a change in the rate at which the tissue moves. It slows it down, which we interpret to mean it's a loosening off of the spasmodic tissue. It's relatively painless, although 1 in about every 30 needles might be a bit uncomfortable. But most of the time it feels just like somebody's pulling a hair out of your head. After loosening up the soft tissues of the foot and ankle, I'll then move on to adjusting the foot. Obviously, when incurring an ankle injury, there's huge distortion to the biomechanics of the foot. So I want to make sure that the patient has as much access to movement through the foot and ankle as possible. He's already been limping and altering his gait up to this point. We don't want to perpetuate that and start distorting his brain's perception of where his joints are in space. It's important to adjust the foot so that the brain has a firm understanding of where the tissues should be. That includes bony tissue and soft tissue. Yeah. So that's good, yeah. Okay, so here it is. So I'm just going to pull down like this. Okay. So just keep that foot really floppy. You okay there?
Yep.
Gotcha. This one as well. Okay, nice and floppy there. You right there?
Yeah, yeah.
Okay.
All good.
I'm just going to push in through there, okay?
Okay.
Nice and floppy for me.
Yeah.
Done.
Yeah.
Okay, so I've moved on to using the cold laser therapy machine, otherwise known as photobiomodulation therapy. If you're interested in reading more about this technique, I'd encourage you to visit the services page on my website, thephysicaltherapycentre.com.au. It's quite detailed and we don't have the time to go through it in this video. Essentially though, what cold laser therapy does is it stimulates the production of ATP in the mitochondria of cells, and that is what's going to accelerate tissue repair. We'll treat locally at the ankle, but also in the lower back, because this is where the nerves that ultimately supply the muscles and the joints of the ankle originate. It's essentially a painless therapy. The most people ever feel is a mild warm tingling, and there's very, very few side effects whatsoever. I'll always look beyond the injured site just to see how the injury has affected the rest of the body. And I'm placing the blocks under his pelvis here because I've identified a leg length inequality where his right leg is shorter than his left, most likely because of a twisted pelvis, so to speak. And I'm now about to move into treating his calf muscle.
Yeah, it's a bit tight. Did you notice that? Is that why you were saying work?
I didn't know, so I just assumed it would be because of your injury and not being able to dorsiflex as much. In most ankle sprains, there'll be a reduction in dorsiflexion range of motion at that ankle. So this is why I like to adjust the bones of the feet, but also like to work through the soft tissues of the calf as well, because through not being able to dorsiflex, the calf muscles aren't getting the normal amount of lengthening as they would through normal gait. So I wanted to dive into his calf and just loosen it up a bit. So you'll see me doing some active release technique on his calf, and then getting a bit deeper using the graston technique tools. Okay, ready? Okay, you right with this pressure?
Go harder. If harder is better, go for it.
Okay. I think we're doing good for now.
Why is that you're doing, which is kind of disruptive on the skin?
Mm-hmm.
Why is that more effective than foam rolling, which seems to get more on the muscle?
Well,
because I know you're not a big foam roller person.
I think foam rolling's okay. I mean, here I will certainly be getting into the muscle.
Yeah.
But this is about stimulating blood flow.
Right.
So it's a little hard to tell here, but you can see some redness coming out within the muscle here.
Right down there, yeah, definitely it's sore. So you want to get blood flow into that.
That's right.
Should I roll that just sitting on a cricket ball or something?
You can do, yeah. Don't do too much of it though, like especially after I've
roughed it up.
Yeah, like this will be enough
Okay.
for today. Maybe tomorrow evening you might want to stimulate it through rolling or heat or
Sure.
spiky ball. You would have noticed earlier on me putting the blocks underneath his pelvis. This was because I identified a leg length inequality. He spent a number of minutes on there now, and upon taking them away you can see that the legs are now even. Any moderate to severe ankle sprain will usually mean the patient ends up limping whilst walking, and in this case the patient had been limping for about 2 weeks, and although he wasn't complaining of lower back pain, he certainly confirmed stiffness was there when I was pushing and prodding on his back, and we could also see the leg length inequality, which meant that there was some distortion through the pelvis and lumbar spine, and so I adjusted him to address that.
There you go.
gash line of that. Oh, that was nice, wasn't it? That was great.
My insides are feeling
That
that.
was huge.
Did you hear it?
Yeah.
Did you?
Oh, mate, it went from my tailbone.
Okay, good. I thought you missed the event.
No. I
don't think anyone could miss that event.
I think
Some people do miss them.
I think it exited through my cerebellum or something. It started right at the bottom.
Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate. Good on you.